how to lose fat and what are the most popular ways by which people are losing weight or trying to lose weight. Usually people are starting their routine from portion control, then they try to eliminate the carbohydrates as much as they can. People usually prefer to go for high protein and low carb diets. Some people like to do 100% keto, which are very few, because there are very few people to whom these kind of keto diets and high protein, it suits their body, it suits their metabolism. But usually many of the patients, many of the clients, the history I get from them is this, that whenever they try to do keto, they have migraines or kidney issues, a lot of problems. It doesn't sit well with their metabolism and their lifestyle. So what people do is this, that they usually start with high protein and low carbohydrate, and then they try to increase their step counts, they reduce the junk overnight food deliveries. With these first few changes, what they do is this, they increase their step count, they try to be more active, they try to be more disciplined, and they stop very high sugar and high salt and deep fried stuff. What happens is this, that they are daily going to check their weight on the weighing scale. After a few days or few weeks or few months, they don't see much difference. It's hardly 1 to 3 kg or 2.5 kg weight loss, and after that the weight loss stucks. It is stuck and it does never moves. This is a very constant complaint in the clinic. But there are clients who have lost a lot of weight on keto and a lot of things. But the problem is this, that whenever they stop doing the diet, they start taking pasta, or they have some cheat meals, or they stop doing a very aggressive gym of 2 hours, they stop doing everything by the book and by the law, they start gaining weight. And usually this pattern usually ends up into a deep depression, because it's very difficult to maintain a very high level of discipline and lifestyle requirements with kids. And when the growing kids at home, you have to look after a lot of things. As a woman, as a mother, you compromise a lot of things for your kids. That's totally understandable. So what happens is this, that in this back and forth movement, you never lose weight properly, you never get your desired results, and you go back to your habits of eating normally. So, and even if you have lost 30 or 20 kg, you are ditching a bit of the routine, the calorie intake is increased, or your step count increased, or your gym, you start skipping your gym, you start seeing that all your inches are coming back and the weight is coming back. So at that point, what clients do is this, that they choose some specific kind of diets or injections or assisted modalities to help them out for weight loss. What are those modalities which people have really opted in previous decades to help them out? We need to discuss about that. Number one, I remember it's been like almost 15 to 18 years now that HCG diet is very famous. It's around the corner. It's being delivered to the patients with a 500 calorie diet, and you have to put one injection in the tummy every day to give yourself the dose of HCG hormone. And this hormone actually helps you to lose weight. And along with that, usually the pattern what I have listened and seen, and it's been very, very commercialized since many years now, that 500 calorie diet box is given to you. There is a sachet in the box which is a supplement. You add it in the water and you drink it. Along with that, you have a very small calorie meal in the breakfast and very small calorie meal in the dinner.